Live streaming it. If you can't catch it live, it'll be on the YouTube page. But if you have a family member or someone else who wants to follow it now, who maybe is at work or got to go on their lunch break, we are going to use the Periscope streaming app, which will allow us to live stream this on both Twitter at South Nassau and on our Facebook page. Did I get that right, James?
You did.
Okay, good. James is our webmaster, and he's in charge of this technology, along with Christy, who's also videotaping it. Zika, of course, is Dr. Nicholas Caraconi. He's a senior OB/GYN clinician on staff here at South Nassau. He has cared for and shepherded through literally thousands of pregnancies for women in our area here at South Nassau. He's a past vice president of the New York State OB/GYN Society. Dr. Caraconi is also a fellow of the American Congress of Obstetrics and Gynecology with board certifications in both those areas. He's appeared on ABC's The View and also on the Food Network's Recipe for Health. To my near right is Dr. Aaron Glatt. He's our chair of the Department of Medicine and chief of the infectious diseases area here at South Nassau. Dr. Glatt came to us from Mercy Hospital, where he was the CEO. He also previously served as CEO at St. Joseph's Hospital. He has a long list of accomplishments, including acting as a spokesperson and district president for the Infectious Disease Society of America. He is a widely published author of more than 200 scientific journal articles and presentations. He also, in the past, has served as professor of clinical medicine and associate dean at New York Medical College. He was actually the valedictorian of his class at Yeshiva University, and he studied medicine at the Columbia University College of Physicians and Surgeons, where he was an NIH research fellow. He was also, among his many other accomplishments, named a top doc by Castle Connolly. Our plan today is very simple. Dr. Glatt's going to give a presentation, and then Dr. Caraconi will come up and speak briefly. There's going to be plenty of time for your questions. So, Dr. Glatt.
Thank you very much, Joe, and thank you all of you for coming here today to hopefully be informed, better informed about this very important subject. I get about 3 to 5 calls a day from people asking me, what is my risk? What is this going to potentially do for me? Can I go on this vacation? We have holidays coming up. Is that going to impact my holiday? There are many other questions that people have, both clinicians who call me up, clergy who call me up, as well as patients who call me up. So this is a very, very important subject, and we need to be educated about it. We need to make sure that we don't overreact. At the same time, we need to make sure that we have all of the information that we need to make appropriate decisions about our lives, about our families, and about how we're going to approach this medical problem should it get changed from what it is right now. But we certainly need to know what it is right now. So I did something unusual today. I took a slide set from the CDC and did not change it. Normally when I make a presentation, I like to use my own material. But I wanted to make sure that people don't think for a second that this is just one person's opinion, although I will add where I have sometimes a difference of opinion or a question on some of the CDC guidelines. But I want to make sure that everybody's aware that what I'm presenting to you is the official CDC presentation, so I actually took a CDC slide set from a presentation that they made last week, used as the foundation for this lecture. There will be plenty of time for us to ask questions. If people have a burning question in the middle of my talk, I'll be happy to take it as well. But I think the talk will flow a little bit more smoothly if we save most of the personal questions till the end of the talk. If there's something that I say that is unclear, you'd like a clarification of what I'm saying, as opposed to a personal type of question, what about if I do this or that? So please feel free to raise your hand and I'll try to take the question at the appropriate time. So I'd like to start off with a little bit of an overview of what Zika is. So I'm not going to get too technical. I know that people here that have a better background, people here that they have no background in science whatsoever. So We need to understand that Zika is not new. Zika's been around for probably over 50 years. Things have changed recently when this hit more of a population center, in Brazil specifically, and where this virus unfortunately has now caused additional problems that were not seen previously. But again, people should realize that this is a type of a virus and a type of a problem that we're quite familiar with. This is not a brand new problem that we're facing that we've never faced before, and we have no idea how it's transmitted or how it's handled. So a little bit of comfort can be taken in the fact that this is not really a very new and strange type of medical problem. It will have its own peculiar issues and its own particular problems that we have not faced previously that we need to address now, but that's something that everybody should take a little comfort in. It happens to be very closely related to some other viruses that are also found in those areas where Zika is found. The two biggest ones are dengue and chikungunya fever. And these two viruses as well can present in a very similar way to Zika. The clinical presentation of the person who gets sick from Zika is usually mild, and I'll talk to you about that. But it can be sometimes impossible other than through laboratory testing to differentiate between some of these viruses. So if somebody's in an endemic area and gets sick, the first and most important thing is to try to establish the right diagnosis, because obviously they'll have tremendously different ramifications for the person. This disease is transmitted by mosquitoes, specific species of mosquitoes. And we'll talk about that in a moment as well, because that's the question that everybody wants to know the answer to, and we don't have the answer to yet, is what is the likelihood that New York is going to have this type of a problem endemic to New York as opposed to somebody who traveled from another area and came to New York. So right away from the beginning, I want to reassure everybody there has not yet been a single case of Zika acquired in the United States. Not one. Every single one of the several hundred cases that have been identified so far in the United States has been from a person who traveled to an endemic or Zika. Now, that can always change at any point in time. It won't change instantaneously. There'll be several hundred cases tomorrow. But if and when that vector, that method of transmission of virus is noticed, you will hear about it. I'm sure every media type will pick that up. Whether it be on the brand new social medias or be in the old printed copy of the daily news of the New York Times or Newsday. So you will hear about that on the radio or on TV or wherever you get your news. And right now, that has not happened. So travel within the United States, or let's say the continental United States, all of the United States, including Alaska and Hawaii, there has not been a native case of Zika. There have been several hundred cases, as I said. And that has to do with how the virus is transmitted. You need to get the virus from a mosquito that has gotten infected from somebody in an endemic area. The mosquitoes in New York, the mosquitoes in Florida, the mosquitoes in the southeastern United States have not been biting people that are infected. There's always the concern that one of the travel people who got their Zika on a trip to Brazil comes back, has Zika in their blood, gets bitten by a mosquito, and can transmit that. That's more of a theoretical concern at this point in time, not a real practical concern that we need to be concerned about. There have been reports of what we call airport malaria. I wrote such a paper about 20 years ago, where sometimes the mosquitoes can be on an airplane from an endemic area. They get on the airplane, they come back, they got a free trip to New York, they get off the airplane, and they bite somebody, and they actually have the malaria bug inside of them. That's extremely unusual. It got me a write-up in a journal article about a case report, and this is known as airport malaria. There have been no cases of airport malaria. There's a lot of conjecture about people getting bitten in the United States who have Zika, then be the cause or a vector, while coming off an airplane. These are theoretical but not practical concerns at this point in time. The mosquito bites people. That's what mosquitoes do. If they bite somebody who has the virus in their blood, so then they pick up that virus, they have the potential, and they bite another person to go and transmit that. So the single most important thing that everybody can do, and this will be useful to prevent any other mosquito diseases. Anybody ever hear here of West Nile? That's a major concern in New York at various times. That's a concern that people have had for other viral diseases as well that can be transmitted. So smart, intelligent people will try to minimize their exposure to mosquitoes. That can be done in a number of ways. Don't go where mosquitoes are. Mosquitoes love to be near pools of water. If you have pools of water in your backyard, like a tire that has a collection of water in it, so get rid of it. Keep the area around you. If you have a swamp near you, if you have some sort of area near you, that's not the best place to have a picnic. So again, common sense, stay away from areas where the mosquitoes are prevalent, because it's not pleasant to have a picnic there anyway. And it's also something that theoretically could transmit other illnesses such as West Nile. And then there are public health measures to control the spread of mosquitoes, that you can spray areas when there are sprayings every year. The public departments, local health departments announce they'll be spraying, staying indoors. Obviously, you try to control the mosquito population. That will be an important vector in the countries where Zika and other viral illnesses are prevalent, to go and try to control the mosquito vector as possible. Certainly, if you're in an area and you can't help it, there are lots of mosquitoes over there, people living in those endemic areas, so putting on appropriate mosquito insect repellents, wearing long sleeve shirts. If you're going outdoors, sleeping outdoors, make sure you have appropriate mosquito netting around you. All very good common sense things that you probably would want to do whether there was Zika around or not, because it's just unpleasant to be bitten by mosquitoes. Now, this is a lot of guesswork from the CDC as to where potentially the mosquito vector, specific mosquitoes, not all mosquitoes are the same. So the slide here shows potentially where the Aedes aegypti mosquito, which is the vector, would be potentially, the key word there is potentially, capable of spreading Zika or other viruses like dengue or chikungunya or other viral illnesses. So again, this is the potential range of these mosquitoes in the United States. It doesn't mean, it's very important, that this is where there is any risk right now. So this is almost what you could put as a worst case scenario. But it doesn't in any way suggest to me that Zika will come to the shaded areas. But notice, it's really in the southern, eastern part of the country where there even is a potential for this. Again, I want to stress, I want everybody to leave here worried about this slide. This is a theoretical slide. I'm not sure I would have included it. It's a theoretical slide. How else is Zika transmitted other than from a mosquito? So this is what really has, I believe, piqued our interest in Zika at this point in time, and what makes Zika so much of a public health problem, because it can be a sexually transmitted disease. That's a very, very important statement to make, because if a person is sexually active with a person who has Zika in their blood or in their semen, we've only seen it transmitted from men to their sexual partner. We have not yet seen any bona fide cases where a woman has transferred Zika to her sexual partner. But since it can be transmitted via the semen of a person to their sexual partner, so in that situation, this becomes a sexually transmitted disease or sexually transmissible disease. So this is a potential vector of transmission. So you have, for example, the wife living in New York. Her husband goes off on a business trip to Brazil. Husband goes off to the Olympics to Brazil in the summer. This will be a major question when it comes to the Summer Olympics. They're in August. This summer, in terms of all the people that will be traveling to areas, the problem is still at Stanford. We have no reason to think that it won't be. This will be a major issue of concern for all of those people coming back and their potential sexual partners. What risk will they have? And this is a very important subject. This is where I get almost as many questions as I do about can I go to Florida type of questions. And here it's very important to realize a couple of facts. Fact number one, there has only been transmission from men to either a male sexual partner or a female sexual partner. Now, I'm not making any comment about what people choose to do in their private lives. I'm presenting the scientific facts. A male who has been clinically symptomatic, now that's a very important fact. The only people that have transmitted to a sexual partner at this point in time have been men who have either already been symptomatic or became symptomatic after the sexual encounter. Those are the only men that have been capable so far of transmitting. That does not prove or mean that an asymptomatic person cannot transmit Zika. So listen very carefully again to what I said. The only recorded cases that we have today of sexual transmission of Zika have been from a man, number one, who was either before, during, or after the sexual encounter symptomatic with the symptoms of Zika. Those are the only scenarios for which we have hard data supporting sexual transmission. That does not mean, but it also doesn't mean the other way. That does not mean that a person can transmit Zika or cannot transmit Zika if they are asymptomatic. We don't know. That's the first point. That does not mean one way or the other that a woman cannot transmit Zika to her partner. We just don't know. I would take some comfort and solace in the fact that we have not yet seen a single such case. But one cannot guarantee that that mode of transmission cannot exist. But again, I think from a comfort level at this point in time, the fact that only symptomatic men and only men so far have transmitted it can put somewhat in perspective the relative risk. Just like with other sexually transmitted diseases, the male may be a more efficient transmitter of the disease than the receptive female partner or the receptive partner. It doesn't mean that it can't go both ways. One is just a more efficient means of transmission. From a purely scientific point of view, we're not talking about any other point of view. So I think that is true so far for Zika. I think we can state that a symptomatic male is a more efficient potential transmitter of Zika to his receptive partner than any other format of sexual transmission. The other major route of transmission of Zika, this is critically important because this is the concern. If Zika didn't do the next thing, we wouldn't be probably having this conference. But the fact that Zika can go from mommy who is infected in utero to baby inside, growing little baby inside, and can have a horrific impact on that pregnancy, ranging from miscarriage, outright destruction or loss of that unborn child, to causing significant medical problems. Everybody's heard the word microcephaly. Other problems in addition to that make this an extremely important public health problem. And this, what we call intrauterine transmission from a mommy to a growing baby inside of her, is why everybody is so excited about this. Because if it didn't happen that way, if this could not cross what we call the placental barrier, if it can't cross the blood placental barrier, and it couldn't get into the baby and affect the baby, so mommy would have an illness that would be self-limited, meaning she would get better from it on her own. The overwhelming number of adults who get this disease and get better is the vast majority of adults. There are rare complications. But it's essentially a self-limited viral disease. So if it wasn't for the fact that this would impact horrifically the baby growing inside mommy, we wouldn't be talking about this. But that route of transmission is so critical and so important, and that's what's made everybody so concerned. The other exposures that the CDC says are possible here are really more theoretical. If a laboratory was dealing with a specimen that had Zika in it, so then there's a risk that the laboratory worker would be exposed somehow, the test would broke, it's splashed on the face. But there is something that we practice called universal precautions, where every laboratory worker, every clinician assumes that every bloody product, whether it's pure blood or a bloody discharge or a blood-containing body fluid, we always assume that they're potentially infectious. So the risk of this would only be in a type of a disaster for that person or laboratory person that they're either not following the protocols and the guidelines, which they almost always do, because it's their own lives that they're putting at risk. But it would have to be some sort of a catastrophic, unexpected accident that exposed them. So that's really a theoretical, hopefully not a practical risk, and certainly the theoretical risk of a blood transfusion. If somebody was in the Zika area and they came back to New York, South there, so just had a wonderful blood drive last week, and they donated at that blood drive. So if we weren't screening for that and not disallowing such types of blood, we don't routinely test the blood for Zika. So therefore, if you were to allow a person from an endemic area to donate, so then theoretically they could have a very mild or subclinical, unrecognizable Zika infection, because most people who get exposed to Zika don't get sick. That's another important factor to remember. Since most people who do get exposed to Zika, not just in the Zika area, they have either no disease or very mild disease. So they come back, they're healthy, they want to be a good citizen, they want to be a good person, and they go and donate blood. Well, theoretically, that blood could be transmitted. That's not a practical rule as well. So that's really not a concern. And likewise, should they donate an organ? So that's why the CDC puts these on. But for practical purposes, what we're really concerned about, other than the mosquito vector, is mommy sexually acquiring it from an infected partner or husband, and then potentially transmitting it to a baby in utero. Not concerned so much about babies that are already born. They'll get mild disease. They're not going to be significantly impacted as far as we know. So we're really talking about babies only inside mom. Again, the key points over here. It spreads only so far from a man to his sexual partners. What happens to a person who gets exposed to Zika and gets clinical symptoms of Zika? Again, as I said, most people who actually get exposed, they're bitten by a mosquito that has Zika, and the Zika virus goes into their body. Several steps that has to happen. Assuming that happens, most people do not get sick. Data that we have so far suggests that most people actually don't get sick. Or if they do get sick, they don't even realize it. I just don't feel so well. The more common symptoms amongst people that get symptoms are listed on this slide. They can get some sort of a rash, very nondescript rash. They can have some aches and pains. They can have a low-grade fever. One of the finest that they have is they can get conjunctivitis. That's a red eye, a pink eye. And then it goes away. And they get better. If they're not a pregnant woman, that's pretty much all that's going to happen. It's a self-limited illness. It will go away in a couple of days, maybe a week or two at the most. And they'll go on with their lives, hopefully. And it will have no impact, no long-term sequelae, as we call it, no long-term effects that we know about today if somebody got Zika. So if somebody said, well, I had Zika 3 months ago, and I'm perfectly better now. My blood tests are negative. So then there's no real concern that that person themselves are really at risk to anybody else. One question that remains unknown is a man who was infected, at what point does his semen no longer contain virus? And that is unknown. Unknown doesn't mean everybody has to be worried that for the rest of their lives, if you were in the Zika area and you got Zika, you potentially have Zika inside you. The data that we have right now, which will improve in the next days, weeks, and months as we collect more data, show that nobody has had virus culture from their semen more than 14 days after they were symptomatic. People have had virus detected, parts of the virus still detected in their semen up to 2 months. Doesn't mean that that's potentially transmissible. We have some really, really fancy tests that we can do. And we can show the footprints of the virus present. The most I've seen published by the CDC is 62 days. So you can still show some footprints of the virus, not live virus, present in the semen of a man who was definitely infected up to 2 months or so after. And therefore, the CDC has made some recommendations based upon these 2 facts that I just told you. But it's not based upon any more data than what I just told you. Since virus can be still seen for a short period of time, live active virus, up to 14 days. So they certainly recommend that if a person has become infected or went to an infected area, that he should abstain from having intercourse with somebody, or if they're not going to abstain, again, you have to ask your own personal clergy person if this impacts your life, whether they can use a condom or not. So the CDC officially recommends that a person use a condom during that period of time or abstain from intercourse for a period of time of 8 weeks. Where did they get the 8 weeks from? They took the 14 days that virus is present, and they said, let's create an additional safe zone. And they arbitrarily picked the number of 8 weeks. And they also have been based upon the fact that you can detect viral footprints for about an 8-week, 62-day period of time. And that's where that recommendation comes from. If the woman is pregnant, and she doesn't have Zika, she was living here in New York, she got pregnant with her husband in New York. Husband goes, she's 6 weeks pregnant, goes off to Brazil on a business trip, comes back. I've been asked this question 5 times in the last week. Not always the same exact scenario, but that scenario. What should the husband and wife do in terms of their personal relationship? So the official CDC recommendation is to abstain from intercourse or to always use a condom until the pregnancy is over. And that is based, again, not upon hard science. That's a recommendation to be as safe as possible and not take any chances. But it's not based upon hard science. It's based upon the facts that I gave you and the seriousness, the potential serious risk to that baby if, in fact, Zika is transmitted during that pregnancy. But that's something that each individual person going to their OBGYN or to their physician needs to discuss, what that recommendation makes sense for them. And it's not based upon hard science, it's based upon the facts that I gave you and nothing else. We will hopefully know more about this. Every day, more and more is being done to test and see what we can know about this important illness. We have excellent tests to detect already whether the person has virus in their blood. There is a PCR test, a polymerase chain reaction test, that can check to see if the person has been exposed and currently has virus in their blood. We don't have that capability for see. People cannot go to their doctor and say, I will give you a sample, please test it to see if I am at risk of transmitting to my partner. We don't have that medical capability. There is a blood test, however, that can be done called an IgM. That is a helpful but not perfect test for somebody who's been in an endemic area to say, did you or did you not get bitten? And we can detect an antibody response in your body to the Zika virus. It is not a perfect test. The CDC does not officially recommend that that test be done. The New York State Department of Health will allow that test to be done if the husband, in the case that we're talking about, the potential sexual partner, has been in an endemic area and has had symptoms of any sort. The reason why is because the only cases where it's been transmitted have been people who had symptoms. So the Department of Health in New York, this is different than New Jersey, this is different than other jurisdictions, will allow a male to have an IgM test done, even if he's not symptomatic right now, but was symptomatic. If somebody is symptomatic right now, so it's important that they get the appropriate diagnostic test done for themselves, which may include dengue, chikungunya, as well as Zika, as well as many other illnesses that the person may be exposed to. Anybody coming from an endemic area with symptoms should see their physician. That physician should be somebody who's knowledgeable about the way illnesses are transmitted in the place that that person traveled to. If you get Zika, as I mentioned, it is, thank God, not a horrible disease if you're a man. If you're a woman who's not pregnant, same thing applies. The incubation period takes a little bit of a while for you to get sick from this. The symptoms are usually mild. They can last a week or two, may even last less. Most importantly, the vast majority of the time, the person gets better. It is not a fatal disease, thank God. It is not a crippling disease. It doesn't have long-term complications. There have been some extremely rare incidents of a syndrome called Guillain-Barré, a paralyzing type of an illness, and associated with a number of other infectious diseases as well. We don't really know for sure. Is it caused by Zika? Skip through some of these slides for time concerns. Just mentioned, in the United States, again, this is the CDC telling you this, not just Aaron Glatt. Not one case has been reported in the continental United States. Also hasn't been reported in Florida or Alaska. However, because of the travel concern, as I mentioned, that's something that they'll look extremely closely about. And there have been, now it's probably over 350 cases. The slide says a week old. So zero, the key point here is zero locally acquired vector-borne cases. The United States has territories, however, that are further south, and Zika has been locally acquired in some of those cases. I mentioned already the diagnostic testing for Zika. And basically what happens if you have symptoms, you've been in an endemic area, you go to your doctor, there is no treatment for this. I cannot give you Tamiflu. I cannot give you an antibiotic. You should never, ever get an antibiotic for a cold or any viral illness. They do absolutely no good. They do a tremendous amount of potential evil and bad for your body. They certainly do some harm to your wallet, and they're absolutely contraindicated. If somebody has a viral infection, there is no reason to beg, plead, cajole, tell your doctor, I'm going to leave you if you don't give me this antibiotic. It's a horrible thing for you to do, horrible thing for your doctor to do, to give anybody an antibiotic for a virus. There are specific viral treatments called antivirals that are not antibiotics that may be appropriate. There is no treatment for Zika. You get Zika, you're going to live with it for another few days, a week or two, and hopefully that will be the end of it. But I can't make it go any faster. There's no over-the-counter, remedy, herbal, potion, anything that you can do to make it go away faster. What you do is treat some of the symptoms, but be careful when you treat the symptoms. We're very concerned about giving aspirin-like products, or what are called the non-steroidals, the Aleve, the Advil, the Motrins, whatever you particularly like. Because sometimes there can be bleeding problems with some of these viruses. Since you're often not sure it's Zika, it could be dengue, it could be another virus, so we tend to be a little bit concerned about taking a product like aspirin or these Motrins, Aleves, Advils that can somehow impact how a person controls their bleeding. So we would recommend that if you need pain control, take something other than those agents. If your physician does diagnose you with Zika, you they will have to notify the Department of Health. We're keeping very close track on every single case so we can figure out and identify if there's any secondary spread. Doesn't really concern you, but don't be concerned if your doctor has to fill out a lot of forms about you, and if you get queries or questions from the local Department of Health, that's okay. They're not looking to harm you, they're just looking to make sure you and all of your family and contacts stay healthy. So, at this point, I'm going to stop. I've spoken for my allotted amount of time. I think I've addressed the major scientific informational pieces of information that you would want to know. Now I'll turn it over to my wonderful colleague, Dr. Zika Symposium, to discuss as an obstetrician gynecologist some of the things that he would like to say, and then we'll open it up for questions in about 5 minutes or so.
Good morning. Obviously, first of all, Dr. Glatt's presentation was excellent. And the facts about Zika have been inflamed by the media. But some of the reasons that we discuss it and are concerned about it as physicians and patients in Central and North America is that there has been an alarming increase in people who have been exposed to and infected by Zika virus, particularly pregnant patients, as Dr. Glatt said, and the incidence of stillbirth, microcephaly, and other brain and neurologic conditions. So if we look at it from the perspective of why are we so concerned about this, it comes down to what can we do as North Americans to avoid it. What we're talking about is a very simple preventive measure. So our entire focus, due to the paucity of data and due to the fact that we just don't know everything about Zika transmission or Zika virus, and as Dr. Glatt said today, is how do we counsel our patients and how to avoid getting Zika, because fortunately we are in a situation still where we can avoid it, and we are not dealing with an endemic area where we are having to treat it. They say that 1 in 5 people, data states that 1 in 5 people who are infected with the Zika virus will have any symptoms: fever, chills, joint pain, and perhaps conjunctivitis. The data states that initially 1% of pregnant women who are infected with the Zika virus will have a child that is affected by the Zika virus, either by stillbirth, microcephaly, etc. There is, however, a study from Brazil that brings that number up to approximately 29%. Neither of these are confirmed, and neither of these are the gospel truth at this point. What has happened, however, in Brazil in particular, is that there have been between 3,000 and 4,000 new cases of babies born with microcephaly. In the United States, where we have a robust healthcare system, that would be devastating. In countries such as Brazil, which has a tremendous amount of political unrest and economic unrest, the effects of that from an economic standpoint will be felt forever. And that's not even mentioning the human standpoint and these lives that are so affected. So basically, all the good news, all the cheery stuff that's out of the way. What we are telling patients as OBGYNs, based on the American College of OBGYN, based on the CDC guidelines, is exactly as Dr. Glatt states, that if a woman is infected with the Zika virus or has traveled to an endemic area, that they should abstain for 8 weeks from attempting pregnancy. We also are, Dr. Glatt and I discussed this earlier, and while this may present some religious or social difficulties for people, men that are infected with the Zika virus who have tested positive are asked to abstain from participating in attempts of pregnancy for 6 months, and for the duration of the pregnancy should their partner already be pregnant, and to use a condom even if they have not tested positive at this point. I mean, I know this sounds like it's very alarmist, but the bottom line is this. You know, do you have to go to Aruba so badly that you're going to risk, issues with your unborn child? That is what we're coming down to. So while we all agree that we do not know everything about it and our recommendations and precautions are over the top, let's think about exactly that which we are speaking. We're not talking about something that is essential to you. So I know that's a weak date. That's not the best evidence-based discussion, but that is the recommendation of the American College of OBGYN is going. So that's it for me. Questions?
Fluid sampling has been detected in every trimester. There has been Zika virus isolated from fetal tissue, placental tissue, amniotic fluid,